Hello friends, let us now learn some important points about. First we will see the differential diagnosis of bloody discharge. If there is bloody discharge, then it can be of three types. One, if you see, there can be smooth intraluminal filling defect. If there is smooth intraluminal filling defect, then this can be duct papilloma. Smooth intraluminal filling defect, it can be duct papilloma. Treatment of duct papilloma is we have to do microdocectomy. Whereas the second one is multiple irregular intraluminal filling defects. If it is multiple irregular intraluminal filling defect, then it is breast carcinoma. Then it can also be dilated duct, can also result in bloody discharge, which is called as duct ectasia. In the duct ectasia, the surgery which is done is Hadfield operation. So this is about the bloody discharge. Thank you.